Okay, so welcome back, everyone. I'm Angela Love,
And I'm Jordan Tucker.
and this is part two of your home birth consult. So normally we offer free consults for anyone interested in a home birth that's pregnant. And so we thought we'd put it on the internet so you can get a lot of these questions out even ahead of time. And yeah, so this is part two. So we're going to start with postpartum and newborn care. So what newborn care do we typically provide after birth? So right after birth, we do a complete newborn physical from head to toe. It's not right after. Right after we're looking at the baby, but I would say we get to the newborn exam maybe around hour two after the birth. So we're weighing the baby, measuring the baby. We're looking at all the parts of the baby. We're making sure the baby looks like a normal newborn. There are occasionally some interesting things, like maybe the baby has a tongue tie. So we're letting you know if your baby has something interesting. Maybe it has a birthmark. Maybe it has a weird skin tag. So we're looking over all of those things. We come back and we do a home visit for you between day 1 and 3. And on that visit, we can do what's called the CCHD, or the Critical Congenital Heart Disease Screening. So that is a pulse oximeter. It tests the baby's oxygen, and we place it on a hand and we place it on a foot and compare the two readings. And that's a screening to make sure that your baby doesn't have any big heart defects. That's recommended to do after the baby's at least 24 hours of age. And so we carry that with us to the home visits, and we do that to make sure baby's heart is good. The other thing we offer is a metabolic screening. If you'd like that, then that's 7 drops of blood, and that tests for about 40 different metabolic and other diseases like sickle cell and thyroid issues, galactosemia, and some of these diseases can cause brain damage or even death. They're quite rare, these diseases, but they're really serious. So if we save one baby's life with them, it's a really good thing. So we offer that free of charge to you, and we'll do that at the home visit if you want, or some people want to wait until the baby's a week old. Um, so
We also
yeah,
have the number for a hearing test to get set up with that for baby if you want that after birth. And then we also offer vitamin K during the first couple hours after baby's born, and the erythromycin eye ointment, which are things that are offered in the hospital as well.
yeah. So those are offerings, and you can choose to accept or decline them, whatever you'd like. Um, how would we help you get breastfeeding off to a good start? Some of it's that prenatal education, where we've taught you some realistic expectations of what breastfeeding is like. Some of it is getting the baby latched in those first couple hours after birth. Um, we know a lot about breastfeeding and how to maintain your supply, how to increase your supply. I do offer frenectomies or tongue tie releases. So those are both offered for our clients and for outside community clients. I get referrals from that from 3 counties from people who want me to do that. And we also, because I can prescribe medications, I can also prescribe galactagogues, which are medications that will increase your milk supply if that's needed. It's not usually needed, but maybe somebody's had abnormal breast development, so it might be helpful for them. Or I've had been able to induce lactation in a woman who was having her baby through a surrogate, but she was able to fully nurse her baby. So we do a lot of good breastfeeding support. Plus, we know IBCLCs. Linda Roberts is quite amazing. We refer to her a lot, but we know those too. So we can get you a lot of good breastfeeding support. How long do we stay after birth, Jordan?
Well, we stay for around 3 hours after birth. Now, that's usually the minimum. We really try not to rush out of your house, after you have your baby. And the reason why we stay that extra hour, that's, the minimum, is so that you can have a solid golden hour with your baby, with it being undisrupted and minimal interventions during that time. We sometimes will stay a little bit longer depending on what you have going on after your birth. If you need a little bit of extra monitoring and support for you or baby, we'll stay as long as it doesn't require 24/7 care.
Yeah.
Yeah.
Okay, how many home visits are we or how many visits are we doing after the birth? So we're doing that one home visit between day 1 and 3. That's going to be back at your house. And then we're doing the rest of the visits back in our office. So most people get at least 2 office visits in postpartum as well as the home visit. So most of our clients are having at least 3 postpartum visits. Many are having 4, and we don't really have a limit on those. So back in the office might be between 1 to 2 weeks. If you're having breastfeeding issues or mood changes or high blood pressure, something else we're worried about, we're going to have you come back again at 3 or 4 weeks. And then everyone's getting usually a 6 week as well. So we like to do a lot of breastfeeding support, and you can come back a lot and talk to us a lot about how things are going.
Hmm.
And we're doing care for both you and the baby during those visits. We're trained in newborn care up to 6 weeks, 6 or 8 weeks postpartum.
And those are still your 1 hour visits where you have lots of time to talk and ask questions.
Mm-hmm. Okay, so next on our list is going to be cost. So what is our fee and what does it include? Our fee, normal fee is $8,000, and that is for your midwifery care. So that includes all the midwifery care for your pregnancy, your birth, and your postpartum and newborn period. So from the minute you become our client up until 6 weeks postpartum, that's all that package. We do offer a sliding scale fee for families who have lower income, and you can talk to our office manager about the requirements for that. Are there any other costs that you should be aware of? So if you want to rent a birth tub from us, it's $150. If you don't have any insurance, so you're going to be paying for all of your labs out of pocket, we offer a lab package for just $400. And if you use nitrous at your birth, that's going to be $300. Do insurance plans reimburse for home birth services? That varies by state. Here in Florida, insurance is mandated. They have to cover home birth, any insurance company that's based here in Florida. So we have pretty good laws protecting that. So each plan is going to be very different with how much they reimburse. Unfortunately, we don't have a standardized insurance company, so they get to decide how much is a birth worth. And some people think, some insurance companies think that all of your pregnancy care, your birth, and your postpartum care is only worth $2,000. Other companies like Cigna is a really great company. They might say it's worth $8,000 or $10,000. And then there's going to be people in the middle. So some of what they pay is just how much they value maternity care. And some of it's going to be based on your in-network or out-of-network deductibles. So we are out of network with all insurance companies. That way we don't have to listen to them telling us what to do. It gives us more freedom. Many times, the birth is going to be reimbursed at the out-of-network rate. So it's important that you investigate that. So let's say, for instance, our fee was $8,000. And you have Florida Blue and they did not grant you a gap exception, they may only pay $2,000 of that. So you've paid out of your pocket $6,000, right? Now, depending on your plan, you may have paid more for that for a hospital birth, with your co-insurance and deductible. Insurance is quite complicated. It is not always an easy thing to understand. We have a great office manager who can explain some of those things in depth with you. We also work with a billing company who does a verification of benefits for you to understand your benefits better if you'd like that, and who can also submit your bill to your insurance company after your 6 weeks postpartum visit. So every plan is so different, it's hard to exactly say how much just generically that your plan is going to reimburse you for your home birth. There is something called a gap exception or an in-network exception where you can say, well, birth is covered on my plan. I want to do a home birth. You don't have anybody that's doing home birth that's in my plan, so I want to get this exception. The automatic answer is usually no. But if you are persistent and you bug them and you call them twice a week, you can get them to change to a yes many times. I was just in the office with one of my clients who did this. And they kept telling her she was high risk because she was over 35. And she kept referring to their discrimination policy that prohibited discriminating against age. And she said, do I need to refer you back to your company where you do not discriminate based on age? And she pestered them and she called all the time and she sent certified letters. And sure enough, she got her in-network exception. She had to be persistent, but for her, it was worth it to save thousands of dollars. So that is an option for you as well. So that $8,000, that is our normal fee. We normally ask for $500 on your first real initial visit. Then you make payments, usually about $800 each visit. And then you're paid up by 36 weeks. That way you don't have to worry about paying us after the birth. We're not running around chasing anyone for any payments that weren't made. Whew, you can relax and settle into your birth. Anything I've forgotten, Jordan, you can think of about that?
Well, they do also have the health share programs. So there are certain health share programs where you pay a monthly fee and then you can also get full reimbursement usually for your care, depending on how long you've been with the health share. So that's a good option for people who are not interested in health insurance or working with those companies. And they're usually, many of those plans have zero out of network, benefits or the word for trying to find the word for like penalty. So yeah.
Yeah, so some of those names, MediShare, Christian Health Share, I think one's called Liberty Health Share. There's several different ones, but the health share companies usually love home birth, and they usually, if you've been with them for, I don't know what their term is, 6 months or a year before you get pregnant, usually they'll pay for the whole thing without a fight, without a hassle, because they know they're saving money. A typical vaginal birth in the hospital might run anywhere from 12,000 to 30,000. A typical C-section in the hospital is probably running somewhere between 20 and 60,000. I recently saw someone's bill that was 120,000 for an uncomplicated hospital C-section. I can't believe that, but yeah, it's gotten a little crazy. Okay, so the other things you can know about, we did talk about our prenatal care only plan for people who don't want to have a home birth but want to have a hospital birth. That charge is $500 for your initial and then $250 each subsequent visit. We have a contract, a financial contract we have you sign when you sign up with us. And it specifies if you do have to transfer, how the cost breaks down, like if you found out your baby had that heart defect, and how each of the visits are going to break down. We like to spell it all out so that you have time to review that before you even sign up with us and are very clear about your investment into your birth. And on my blog that I have on the website, one of the entries is how much is a good birth worth? A lot of us spend a lot of money on our weddings, which is one day in our lives, a great party, a celebration of your love. Weddings are beautiful, right? Birth can also be beautiful. It can be powerful. It can be traumatic. So your birth is quite valuable in how you enter parenting and mothering, how you feel about yourself afterwards, So I love weddings, but I would say your birth is an even more important investment into your life. So consider it that. Consider how much we value birth as a society. And like I said, we also have that sliding scale package if you have a lower income. And the other things we have is I do telehealth. So people who aren't even my client, I do telehealth. I have a company called Midwife RX. And that's like for a brief, usually 15-minute consult for $74. And so right now we're operating in 35 states. We're adding more all the time. And we treat mastitis, UTIs, ROGAMs, birth control, postpartum depression, progesterone supplementation. So we have midwives all over the country working there, providing midwifery care virtually to people who want that, Midwife RX. Okay, and so the last thing we want to talk about and is home birth safe? And what do we do if we need to go to the hospital, right? Some people are quite dreamy and want to say, that will never happen to me. I know I'm going to have a home birth. I got it all planned out. And that's great to have that visualization. But you also can't guarantee that that's going to happen. So I do think it's important that we talk with all of our clients about a plan B and a plan C. Um, if we have to escalate care a little bit, what that looks like and how that would happen. I think it really helps for us to have that plan and for everyone to realize this, it could be a necessity in any birth. So when you're signing up with us, we're not guaranteeing you a home birth at all cost. We are guaranteeing you that you will have midwives by your side for this journey. That's what we're trying to guarantee you here. Okay, that you will have good, solid midwives by your side. So is home birth safe? So lots of studies done all around the world have shown that home birth for low risk women and experienced providers is quite safe. Okay, we have lots of good studies on that all around the world. There are some rare events, quite rare, maybe 1 in 1,000, where it might be safer to be in a hospital with the C-section room right down the hall. Say if somebody has a cord prolapse, and a head down baby, you want to get to a C-section real quick. So that may be 1 in 1,000 chances, and that's quite rare when you're not running around breaking water bags. Okay, and a head down baby with the cord prolapse, I think I've seen 1 in 21 years, and that lady did fine, but I'm just saying it's quite rare. Compared to the risk of going to the hospital, people don't talk about what are the risk of hospital birth. The risk of hospital birth is having a C-section that you actually didn't need, having interventions that you really didn't need, having disrespect, possibly, coming out of there with trauma because you were not involved in the decision making. There are risks of going there as well. The World Health Organization says the C-section rate should be under 15% in all situations, in all communities. Our national average for C-section rate in the US is over 30%. It's around 33% of women. A third of all women are getting cut open to have their babies. So according to the World Health Organization, about half of those are actually unnecessary C-sections. They're because we meddled with things, right? They're C-sections that weren't actually warranted, and that person could have had a physiological birth.
Yes.
So that is the risk of that is the real risk of going to the hospital. And there are, so home birth is safe for low risk situations with experienced providers. So we're going to start with that. Now let's talk about what do we do if we need to transfer. So if a transfer becomes necessary, which hospital do I go to? So if we need to get there real quick, we're going to go to your closest hospital. So like in this county, we have one hospital that does maternity care. It's called Cleveland Clinic of Indian River County. So we would go there. Most all hospitals will offer a hospital tour maybe once a month. So if you want to see the hospital, you want to feel comfortable there, get an idea of what that looks like, you are free to call that hospital and join up with one of their tours, and they will show you around. Some hospitals have childbirth education class packages too that inform you about like what are their hospital policies and what's the kind of things they do at hospitals. So like Jordan mentioned earlier, whenever we have a transfer, we call ahead, we let them know we're coming. We send your records ahead so they know what's been going on in your pregnancy. We let them know verbally what's been going on in labor. And then one of our team will go with you and usually stay with you until you have the baby. And then you can continue with all the beautiful postpartum care with us and the lactation help that's very valuable. So if we don't have to get there quickly, you could choose any hospital that you want, usually like in an hour radius. So another great hospital in our area is Cleveland Clinic down at Tradition. There's a bunch of midwives there. They're really open to alternative birthing positions in labor. So yeah, we've had some good experiences there. And like Jordan says, sometimes it's a luck of the draw, which doctor's on call.
Yeah.
Which receiving doctor, which receiving midwife. So if it's not super urgent, we might call around to see who's on. Some doctors are more friendly towards home birth than others. and we take notes. So, what problems, what do you want to say, Jordan?
I was going to say it's a mixed bag who you'll get even if you're planning a hospital birth, right? So, that's just kind of how it goes with hospital staff. They have their days off and they have different rotations with clinicians. So, if it's a true emergency, we'll always call 911 and transfer in an ambulance to get there quickly. And usually around 28 to 30 weeks, we're going to go over our transfer plan individualized to you. So we'll map out your house versus the closest hospital so you know where to expect. And like Angie said, you can do tours, you can do your research, and just kind of go from there.
Yeah. And I would say maybe about a third of our transfers are actually in the ambulance. Most of them are not. If we do go by ambulance, then usually one of us will try to ride in the ambulance with you if the EMS is cool with it. And then your partner would follow behind in their car.
Yeah.
So what problems or complications could happen during labor or birth that would require you to transfer to the hospital? So I would say the biggest, most common reason is a first timer who's had a really long labor. And it could be that we have a lot of maternal exhaustion going on, or it could be that things aren't progressing. That's our most common reason. So we're not quick to rush to that decision. It may be that you've gotten into active labor, you're 6 centimeters, you've had tons of great strong contractions happening quite frequently. We've done all the position changes. And if 12 hours go by and you're still 6 centimeters with very little change, we're going to have a conversation like, hey, this doesn't seem like it's progressing normally. We think that maybe the hospital might be a good idea for you. If everything's stable, if the vital signs and the fetal heart rate stable, at that point you could say, no, I got all the energy. Let's keep going. And we can reevaluate in another 4 hours. So like I said, it's a conversation that's happening. Some other things that could happen could be fetal heart rate changes. Sometimes we'll have a little blip in the fetal heart rate and we'll change positions and then it'll go away. And usually that's fine to continue on and we'll avoid that position that triggered it, right? But if it's persistently having some heart rate decelerations, then it's time to go in. If you have preeclampsia, your blood pressure is going through the roof, that would be a reason to go into the hospital. Somebody has a fever in labor, chorioamnitis, infection of the baby, that's something you don't want to play around with at home. If someone's having preterm labor, say somebody's 32 weeks and going into labor, that's way too soon to have a home birth. So that baby might need a really intensive support at birth. That would not be a good indication. For someone who has postpartum hemorrhage, now we have a lot of good postpartum hemorrhage medications to give you if you need it. We have IV fluids to restore it. And most of the time, we can handle a lot of postpartum hemorrhage at home. But if you've lost so much blood that you're having persistent dizziness or really abnormal vital signs, then that's going to be a reason to go into the hospital. You might need a blood transfusion. Sometimes that happens. And then if the baby is having a prolonged resuscitation, so only about 1% of babies need PPV, or what we call bag and mask. But if we're going on and we're having to bag that baby for like 5 minutes, that's a baby that usually should be observed in the hospital for 24 hours. Or if a baby even maybe didn't even need that, but is having persistent grunting, so any kind of like a respiratory issue in the baby, that would be another reason to go in. Have I hit the main ones, Jordan?
Yeah, those would be the more common ones. So although transfer for those reasons are not common.
Mm-hmm. Yeah. So we would still be with you. One of us would go with you, but in the hospital, we would not be the one in charge of making medical decisions anymore. We would transition more to like a doula or a guidance kind of role. And then once again, we could continue with all your beautiful postpartum and lactation support visits after that. Are you certified in neonatal resuscitation, NRP? Yes, we are. So everyone who's at your birth is going to be certified in NRP. Resuscitation equipment that we have for baby, we have ambu bags, which are like the little bag and mask. We have suction, we have oxygen, And we have this thing called an LMA, which is a laryngeal mask and airway. We also carry epinephrine. So obviously we don't use those things all the time, but we have them and we're ready to use them at every birth. So when we're at the birth, we set up kind of like cookie trays. One of them is going to be specifically for neonatal resuscitation. One of them is going to be for the birth. So wherever you're at birthing around your house, we can quickly transport the equipment we might need to the area. What percentage of your home births have involved transfers in labor and birth? So our transfer rate we calculate every year. We submit our data, and I submit mine to the ACNM benchmarking. It usually relates to somewhere between 8 and 12% transfer rate, and it varies year by year depending on our clients that year. That's the in labor transfer rate. So usually we have a less than 1% postpartum transfer rate, and usually less than 1% of a baby transfer rate postpartum.
Yeah, and this statistic, this encompasses all moms, first-time moms, VBACs. This encompasses twins, breaches. So some statistics can be skewed, like Angie said, depending on our client list that year.
Yeah, and we do a lot of VBACs. So VBACs are vaginal birth after C-section. Our local county hospital hasn't offered them as of yet. They keep talking about it. I hope they will any day. Tradition has started to do VBACs, which is a very welcome and good change. Lawnwood does VBACs. So with the rising C-section rate, there are a lot of women who want to do VBACs. So we do provide that. And we will do that after 1 or 2 C-sections. And we usually review your operative report to make sure that you had a normal surgery. Okay, so we covered that. Okay, the other thing was our C-section rate. What percentage of your clients who begin labor at home end up having a C-section? And that's usually 5 to 10%. So sometimes when we go to the hospital, we have a vaginal birth in the hospital, and sometimes we end up a C-section. So transferring to the hospital doesn't for sure say that someone's going to need a C-section. It just means that they need to have a hospital birth. Okay, and so like Jordan was saying, a plan B and a plan C. Some people, especially first timers, as they learn about different things that could be possible in a hospital birth, vaginally or C-section, they start thinking about what they would prefer. And sometimes your doula will help you make a birth plan. We give everyone a birth plan to fill out for home birth. And it's a beautiful thing that talks about what would make this birth super sacred to you or magical. What are affirmations you really love that you want us to say to you? Does your partner want to help catch the baby? You know, what are things that you don't like that would traumatize you and would let us avoid those, right? So our birth plan is going to have fun stuff on there. What photos or videos do you want or not want? But people also sometimes like having a plan B birth plan. Like if I did require a transfer, what are the most important things to me in the hospital? Or if I did end up having a C-section, what are the most important things for me during a C-section? And then you've planned it all. You've got it all written down. You don't have to think about it anymore, right? If you're stressed out and tired in labor, you already have a plan. Okay. So the other question on this sheet was, if somebody has a particular health issue, how is this going to affect me during pregnancy and birth? So obviously everyone has tons of different health issues. So be honest with us from the beginning, include all of your health history. Let us know what it's been like so we can talk to you about what the implications of our all for pregnancy and birth. And many times we'll say, oh, no problem. You know, oh, you have a history of HSV, herpes, genital herpes. We'll give you some bowel checks at the end of pregnancy and make sure you don't have an outbreak. Perfect. You know, and other things are more serious. But yeah, that's why we do thorough screenings and we do ongoing screenings to make sure that you're a good, safe candidate for home birth.
Yes. Yeah, anything that we think might leave you high risk and might be safer for you to give birth in the hospital, that's something that, you know, it's important to know ahead of time so you have lots of time to prepare. And yeah, that's our goal, is safe home birth.
Yeah. I think we've covered a lot of information. The other person on our team currently, and hopefully forever, is Becky Berry, and she is our office manager extraordinaire. She handles scheduling, she handles insurance stuff and billing stuff. So she's usually actually your first point of contact who's getting you booked in for your free consult. And then during that free consult, you can ask whatever questions you want. We talk a lot about whatever you kind of guide the conversation and get to know each other a little bit to see if we're a good fit. And sometimes if we're not a good fit, we'll tell you, hey, there's this other midwife who might not be a better fit for you, because you want to feel comfortable with your midwives, like you're on the same page. So I think that we have an amazing team. I bring the broader scope, the nurse midwifery. I can write prescriptions. That's helpful to some people. Jordan's like an herbalist, and she makes some of her own herbs, which we can sell in the office, and a vast herbal knowledge, and so gentle and patient. And Becky brings all of her administrative skills. So we have a really amazing team to help you on this journey.
And we're excited to have you.
Yeah. So we do serve an hour radius of Vero. So we go all the way down to like Palm City, and we go all the way up to like Satellite Beach. We have our main office that's in Vero. And just this year, 2025, we've opened up a location in Melbourne. It's kind of like downtown. And we're there a couple days a month. So we open that up for our Melbourne moms and families. They wouldn't have to drive so far for their prenatal visits. Yeah. Well, hopefully this has been helpful. It's been great to see you, Jordan, and I look forward to being a part of your journey. And give us a call. Our website is www.midwifelove.com. And our office phone number is 772-766-5683.
Okay, and don't forget to check us out on Facebook and Instagram. We've got lots of good educational videos on there, and some information on statistics if you're looking for more.
Yay. Okay. Bye.
Bye.